So the normal axis of the heart in the chest should be levocardia, and the axis should be at 45 degrees from midline, and it's plus or minus 15 degrees in the first trimester and plus or minus 20 degrees in the second trimester. Again, occupying about 1/3 of the chest or about 33% of the area. And the circumference should be less than 50% of that chest. So looking at the heart, one rib on each side, looking at the spine, so posterior to anterior. If you draw an imaginary line dividing the chest into half, we come along where we can see the interventricular septum and where we see the valves are coming off the septum or following the septum all along here. You just do an angle and looking to see how many degrees that apex is off from the center of the chest. Then doing the circumference, we're looking at putting a tracing around the heart and then around the chest. And again, we want to see that less than 50. And then usually following the LARA principle, we will document the heart rate with M mode. And then we'll also be doing the inflows and outflows with Doppler. All right, so when the apex of the heart is pointing up, then we can actually get some dropout at the crux of the heart here. So when the sound beam is parallel to the interventricular septum, this is a pseudoseptal defect. So we put color on there, try to get that septum as perpendicular to our ultrasound beam as possible to make sure that we do not have a defect. So we want to make sure we're sweeping through the entire heart. On this one, we thought we saw here that there was a little bit of a defect. And when we turn the patient to the side, we truly do see a little bit of crossing of blood through a little septal defect here. So then we can get a cross-section short axis low of the ventricles, and then again, turning your PRF down, your color gain up to see if there's any flow across that septum. And then this is that short axis low. So you can see right here, even without color, you can see that little dropout, that little defect right there. So getting that evaluation of the septum perpendicular to the septum, and then that short axis low.